How has recognizing asthma symptoms changed over time? Imagine trying to understand a puzzle with missing pieces. That's how early doctors viewed asthma symptoms. For centuries, people noticed wheezing and trouble breathing but didn't know what caused them. They saw these signs as respiratory distress but had no idea about the underlying triggers or treatments. Over time, the way we recognize these signs has become clearer and more detailed. In the 1500s, doctors started thinking asthma was linked to problems in the lungs' airways. They observed that certain activities like exercise could bring on symptoms. By the 1600s, they noticed dust and other environmental factors could worsen breathing issues. This was a big step because it showed that external things could trigger asthma attacks. Moving into the 1800s, doctors found pollen could cause asthma symptoms, especially during certain seasons. This helped them understand that allergens in the environment played a role. By the early 1900s, medicines were developed that relaxed the muscles around the airways, making breathing easier for many people. In the 1920s, scientists realized that not all asthma was caused by allergies. Some people had asthma without clear triggers. This was important because it showed asthma could have different causes and that each person might react differently to various triggers. As the years went by, doctors learned that asthma wasn't just about sudden attacks. It could cause long-term changes in the lungs, like swelling and thickening of the airways. This meant that asthma could involve ongoing breathing problems, not just quick episodes of wheezing and coughing. In the 1960s and 1970s, new tools like peak flow meters came into use. These devices measure how well air moves in and out of the lungs. They made it easier for both patients and doctors to track how severe asthma was and how well treatments worked. By the 1980s, understanding of triggers like allergens improved. Doctors learned that when someone with asthma encounters a trigger, their body releases chemicals that cause the airways to swell and tighten. This leads to the classic symptoms of wheezing, coughing, chest tightness, and shortness of breath. Today, recognizing asthma symptoms involves more than just listening for wheezing. People are taught to watch for coughing, especially at night or during exercise, and for trouble breathing or chest tightness. Doctors use a mix of symptom history, physical exams, and lung function tests to diagnose asthma and see how well it's controlled. Overall, recognizing asthma symptoms has shifted from simply noticing breathing problems to understanding the different triggers, patterns, and long-term effects. This progress helps people manage their asthma better and live healthier, more comfortable lives.